and welcome to Health Talks, the podcast where we unpack important health issues affecting our communities. I'm your host, Kelvin from Mariva Radio, and today we are diving into a topic that continues to shape millions of lives around the world. We aim to raise awareness, correct misinformation, and encourage healthy behavior. Joining me today is Mr. Enoch, a public health advocate who has been working closely with HIV prevention and supports programs. Thank you for joining us, Mr. Enoch.
Thank you for having me. It's an honor to be here and share important information.
Now, maybe to start with, understanding HIV and AIDS. Many people still confuse HIV and AIDS. Could you explain the difference?
Absolutely. HIV is a virus, which means human immunodeficiency virus, that attacks the immune system. AIDS, which stands for acquired immunodeficiency syndrome, in an advanced stage of HIV infection when the immune system becomes severely damaged. So HIV is the virus you contract, while AIDS is the condition that can develop if HIV is not treated.
That is a very clear distinction. Thank you for that. Now, let's talk about transmission. How does HIV actually spread?
HIV spread through contact with infected blood, semen, vaginal fluid, rectal fluid, and breast milk. The most common ways include unprotected sexual intercourse, sharing needles, mother-to-child transmission during pregnancy or breastfeeding, and transfusion of contaminated blood. Importantly, HIV is not spread through casual contact like hugging, shaking hands, sharing utensils, or sitting next to someone.
That is very important because stigma often comes from misinformation. Maybe talking about signs and symptoms. What are some early signs and symptoms of HIV infection?
Some people get flu-like symptoms 2 to 4 weeks of infection, fever, fatigue, sore throat, swollen lymph nodes, but many may not show symptoms for years. That is why regular testing is crucial.
Good point. Testing is really the key. Maybe talking about testing and early diagnosis. Why is early testing and diagnosis so important?
Early testing allows person to start treatment sooner, which helps them to stay healthy and reduce the risk of transmitting the virus to others. With proper treatment, people living with HIV can live longer and healthy lives.
That is really encouraging. Treatment has really come a long way. Now, about treatment. What does ART mean and why is it so much recommended?
ART stands for antiretroviral therapy. It's combination of medicines that suppresses the virus and allows the immune system to recover. When taken correctly, ARTs reduce the viral load to undetectable levels, and an undetectable viral load means the person cannot transmit HIV sexually. We can call this U. U means undetectable equals untransmittable.
That is a powerful message. Treatment protects both the person and their partner. Now, about people living with HIV. What does daily life look like for someone living with HIV today?
With consistent medication, healthy habits, regular checkups, and most people with HIV live normal lives. They can work, study, have relationship, even have HIV negative children. The biggest challenge is often stigma and not the virus itself.
Now, stigma can be more harmful than the disease, absolutely. Maybe we can talk of prevention strategies. What are some effective ways to prevent HIV infection?
There are several strategies. One, using condom correctly and inconsistently, and then reducing number of sexual partners, using PrEP, which means pre-exposure prophylaxis for high-stake risk individuals, and then not sharing needles. You do regular testing, ensure safe blood transmission, and then also for pregnant women who are living with HIV, taking ARTs to prevent mother-to-child transmission.
Those are very practical, evidence-based methods. Anyone can apply them. HIV-related stigma remains a big problem. How does stigma affect people living with HIV and AIDS?
You know, stigma creates fear, shame, and discrimination. It stops people from getting tested or seeking treatment. It can lead to isolation, depression, and even job loss. Combating stigma is an important as providing treatment. People need support, not judgment.
Absolutely. We must fight the stigma as much as the virus. Now, about supporting someone with HIV. What are some ways we can support someone living with HIV?
Okay, we can offer emotional support, judgments, and avoid judgments. We encourage adherence to treatment and educate others to reduce misinformation. Most importantly, treat them just like anyone else. HIV does not define a person.
That is a strong and compassionate reminder. As we close, what message would you like to share with our listeners regarding HIV and AIDS?
My message is simple. Get informed, you get tested, support others. HIV is no longer a death sentence. With treatment, people can live longer and healthy lives. Let's work together to create a society free from stigma and fear.
Oh, wow. Thank you. That is a powerful closing message. Thank you so much, Mr. Enoch, for showing your knowledge and experience with us today. And to our listeners, thank you for turning in to Mariva Radio. Maybe a reminder is awareness saves life and compassion strengthens community. This has been Health Talks. I'm Kelvin from Mariva Radio. See you next time. Thank you, Enoch.
Thank you so much.